usually super clear. I like her. Right? Like you all.
Already? Good afternoon. I'm pleased to say that our successful effort to defeat COVID and return to our normal activities continues to gain momentum, and we have some further good news in that direction today. We're very pleased that students and educators and staff are continuing to return to the classroom now across the state of Washington, using safety protocols that we know that work. And today I'm glad to be able to say Washington is embracing new guidelines that are safe, that will allow even more students back into schools on a more normal setting. The last few days, the State Department of Health and my staff have been reviewing the Centers for Disease Control guidance. And that guidance will allow schools to return with less space that have to be reserved in the classroom, approximately 3 feet instead of 6. This is very important because schools have been limited now by this 6-foot requirement, and due to spatial requirements, it has not allowed them to return to normal everyday activities in the classroom. So today I am ordering that we make this new standard available for all schools that want to adopt it. And they can do this immediately. There is no waiting period. This order will allow school districts the flexibility to make the right decisions and the right choices for their students and their educators and their families and their larger communities. Now, we know and we are confident in this decision because in addition to the CDC guidance, which has been based on huge assessment of the science, there are thousands of schools today operating across the country under this guidance right now and operating safely. It's importantly, this order removes another barrier that would otherwise prevent the full reintroduction of children into the classroom in a more normal setting, full time. And we know people have been very much anxious to be able to go back full time in this regard. Now, obviously, in order to limit transmission, everyone in the school needs to continue to wear masks because they are effective in limiting transmission. And I have to tell you, I've been so pleased to see that schools that are already back in the classroom in hybrid models have shown enormous compliance with this mask wearing. It's the reason why it's one of the principal reasons it has been successful. These kids are a lot smarter than we used to be. They wear their masks. And as a result, we know that this can be done safely. As I've indicated, this order takes place immediately. People can make decisions, school boards can now make decisions to go back immediately to full-time operations, assuming they meet this 3 feet requirement. And we know that the vast majority can do that because so many schools have been able to do this. So we're very happy about this. We estimate, talking to the educational service districts, that there's at least 200 school districts that already have brought back children in some hybrid model back into the classroom that we think should be able to make this transition very rapidly. And it applies to all school districts. So whether or not your district has gone back into a hybrid model, you can start tomorrow going back into the, what you might call the full meal deal, assuming that you meet this 3-foot requirement. Again, we think schools can. So good news on this front. We know our children have been experiencing tremendous mental health challenges and disturbances. The more children we get back in the classroom, the faster, the better. This is a major step forward in our continuing effort to help our students get their feet under them, deal with these mental health challenges, and see the magic that happens between tremendous educators that we have in our state with these students. Now, as long as we continue to talk about the future, as long as we continue to see reductions in COVID activity into the summer and fall, we fully expect that this will become an expectation for all school districts that we have normal operations when we reopen in the fall, and that will be an expectation for all districts. That's the right thing to do. We think it can be done safely, and we will look forward to that. So districts should be planning for that for the next fall's activities, but you don't have to wait. This could happen beginning tomorrow when things can get worked out. Now, at some point, we hope to be able to, obviously, to remove any distancing requirement. That's not today, but I do feel with the success of these vaccines, that day will come. We have seen hybrids models working, but we know that full-time instruction is the best if assuming parents want to have that route. And returning full-time instruction can be done safely, and making that option available to parents is obviously necessary. Now, districts have been doing a good job also offering a remote option, which will continue to be an option for parents in these districts. And that's the intent of my order today. We have another layer of protection as well, in that most school staff has now had at least one vaccine dose and are on their way to be fully vaccinating. Access continues to increase for the general adult population as well. And of course, families will continue to have that remote option. Now, that said, we know everyone's going to continue to use caution and follow the protocols, and that's what has allowed us to be so successful to date in our reopening plans. If I can turn to our vaccination efforts, our tremendous progress in vaccinating Washingtonians has continued with incredible momentum recently. We now expect to have administered over 3 million doses this week. Last week, the 1 millionth Washingtonian became fully vaccinated, and 97% of the vaccines that are in our state supply chain for which we administer, 97% of those doses are in people's arms today. We're happy about the efficient progress we're making to make sure people have access to these vaccines. We're also very appreciative of the administration that has dramatically increased the supply of these doses, and we're confident that that will continue to on an upward curve. Now, we're also making a lot of efforts to make sure everyone has access to this vaccine. We know that healthcare has been disparate in our society. We know that people have different capabilities of language and transportation and physical location. So we have been partnering with local public health officials across, particularly Central and Eastern Washington, to set up pop-up vaccination clinics. And we'll continue to do so that we can take the vaccine to where working people are, particularly in the agricultural industry. I toured the first one at Chelan Fruit last week, and that's going to get many more doses in the arms of our state's tireless agricultural workers. We are surveying the major agricultural employers, and I'm pleased to report that we have plans underway to make this vaccine available in a much more efficient and achievable result for these hard-working folks. So equity remains crucial in our vaccination efforts. And that's why I'm also pleased to say that since September, we have signed community outreach service contracts with more than 40 different local organizations that work with communities to raise the awareness and hope to coordinate access to these vaccines. I think we might have a graphic up on the screen of the list of those, is that right? This includes the Yakima Nation, the Latino Community Fund, the Council on American Islamic Relations, the African American Health Board, and the Asia Pacific Cultural Center, just to name a few of these organizations. And the reason this is so important is these community organizations obviously know where their folks are, some of whom have not had a lot of contact with health folks who might have transportation and linguistic problems, and they can help both people get over vaccine hesitancy and plug them in to where these vaccine sites are. And we really appreciate our local partners. We're continuing to expand the number of these community organizations that are involved to be as close as we can to the actual neighborhoods. We've already invested $4 million into these outreach programs, and we plan on investing more. That includes an extensive media campaign to provide information about the vaccine to folks in multiple languages. I think we're up to maybe 32 languages now of providing information to people. And that effort's going to continue. We're really happy about the launch of our vaccine locator tool. It launched last week. And this allows people to have much easier access to find out where vaccines actually are available in almost real time. It has seen 396,000 plus users since going live just a few days ago, and 265,000 people have had connections to make appointments with the provider through the vaccine locator. Now it can be accessed at vaccinelocator.doh.wa.gov. That's on the screen, I hope. Tell me it's on the screen. Great. Now, or you can call 1-800-525-0127, 1-800-525-0127 to schedule appointments as well. I want to note the phone call system. We want to do things where everyone has access to this vaccine, even if you're not really a great computer user. So in our max vaccination sites, for instance, at Wenatchee, a certain percentage of the appointments are being reserved for phone appointments. So if you're an agricultural worker and you're in the field and you don't have access to a computer, but you do a phone, we want to make those available through the phone system. And we are finding this is a useful strategy to allow people who, just don't have good computer access to be able to get appointments. This is an important part of our effort to have an equitable distribution system. We are now less than a week from the next round of vaccine eligibility. Right now, some 3 million Washingtonians are eligible, and another 2 million will be joining them next week. As you know, all 6.2 million Washingtonians over the age of 16 will be eligible by May 1st at the latest. Now, this eligibility obviously does not guarantee everyone gets vaccinated the first day. We obviously still have limitations of doses, but we're pleased with the progress we are making. For more on today's announcement, I'm joined by Department of Health Deputy Secretary for our COVID response, Lacey Fehrenbach. Lacey, looking forward to your comments.
Thank you, Governor. Good afternoon. From early on, we have sought to navigate through the pandemic guided by science and balancing the countless physical and mental health benefits that in-person instruction and services schools provide to our children with the need to protect our school staff, our students, their families, and our communities from COVID-19. We all care very deeply about our children, and we also care very deeply about the educators and school staff. They're the people who make our schools great and provide these benefits to our future Washingtonians. The science continues to show us that there are two major areas to focus on as we think about limiting the spread of COVID-19 in schools. To reduce the level of disease in the community around the school, that helps us reduce the chance of COVID being introduced to the school environment. And then within the school, layered prevention strategies to reduce transmission among students and staff. Over the past few months, there have been a number of studies that have come out demonstrating that these layered mitigation measures limit transmission in schools. And these include recent studies from schools in Wisconsin, Utah, and Massachusetts. In those three studies in particular, there was very little transmission in schools, even at distances of less We have updated our guidance at Department of Health, and that's posted on our website, doh.wa.gov, for K-12 schools. And I want to put up two visuals that show what is different in regard to distancing. This recommendation aligns fully with the CDC's updated guidance. We recommend that students practice physical distancing of at least 3 feet or more in classrooms as much as possible. There are some circumstances where at least 6 feet must be maintained, and those include the following. Among students and staff in common areas of the building, such as auditoriums, anytime that masks can't be worn, so when people are eating meals, for example, or during activities when increased exhalation occurs. That's because the more we're breathing heavily, the more potential we are creating for aerosols or droplets to spread. And those are things like singing, shouting, playing instruments, or engaging in PE. The other thing I want to note is that our guidance does still recommend 6 feet of distance between adults, and that would be the staff in the building or any volunteers who may come on site. I also want to remind people that our guidance has all of those other layered features, including consistent, correct use of masks, good hand hygiene, cleaning and improved ventilation in the schools, and the ability to rapidly respond when people have symptoms or cases with the appropriate testing, contact tracing, isolation, and quarantine. And then very importantly, as the governor mentioned, for families or people at risk for severe COVID-19 or who have other needs, there is a remote option to protect their health. Our state data suggests that our school leaders, our school staff, our students are doing an incredible job at implementing these measures, and they're making a difference. Additionally, over the past couple of months, we have added some resources to help support testing on site for schools who want to provide that, and provided vaccines to school staff. Now, I'm going to turn to what's happening around the schools, because that's the other important factor, the transmission around the schools. We have made tremendous progress through the beginning of 2021. However, there are some signs that our progress is slowing. Many counties are seeing plateaus in their case rates. There is some variation from county to county, with some seeing increases and a few still decreasing, but we're at a pivotal moment here. Our statewide daily case counts have flattened at a relatively high level of around 650 new cases per day, and that's about where we were in the early fall, and much higher than we were when we leveled off after our July wave. There are also some signs that transmission is starting to increase again. Vaccines are making a huge difference. They have helped us bring down our rates, and they are helping us continue to bring down our hospitalization and death rates. But there are still more than half of us who are susceptible here in Washington. And we know people are excited to move to phase 3. We know you're ready to get together with your family for holidays, to play more sports, and so on. We're excited about these things too. It's imperative that we undertake them cautiously given where we are, and given that we want more students to return to in-person learning. That means wearing our masks, watching our distance, using Law Notify when you go out in public, and staying home anytime you feel sick. I want to call out one thing in particular this time of year. Many families may be thinking about a spring break trip. Many college students may want to return to their families back home or go on a road trip with their friends. Travel is not recommended at this time given where we are. It increases your risk to get COVID-19 and spread COVID-19. The safer choice for our families, for our schools, and for our communities is really to stay home and keep your activities close to home. You can visit one of our amazing parks here in Washington State. You can support your local museums or art scene, but please make the good choice and don't travel for spring break. We are so close to the end, and we want to keep going forward. So with that, I will turn it back to you, Governor Inslee.
Thank you, Lacey. Thanks for your leadership. It's bearing great fruit. I just want to segue on one thing Lacey talked about, how people are doing such a good job in our schools being safe. And I frankly think this has been remarkable. I've seen educators, staff really develop in extremely challenging circumstances, protocols and logistics that can get our students back into school. I've seen it across the state of Washington. And that's what gives me confidence that we will now be able to see more of our students return to much more normal school situation because they have been so good at this and they have been so diligent. We ought to be thankful for that, of finding innovative ways to make this happen. So I think this is a good news story based on confidence we have in educators and community members and parents being able to move forward like this. And I want to note that. I want to follow up on Lacey said too about caution. I think this is a difficult challenge for us at the moment because we're also joyous about the coming of spring and the coming of vaccines and the coming of new opportunities in our business and social lives. The joy of hugging your grandchildren, I can tell you, is unsurpassed. And the joy of kids hugging their grandparents, I think, is pretty good too. And so we're kind of rapturous at this moment, rightfully so, after this long, long year. But the question is, can we maintain at the same time of rapture a sense of diligence and discipline to protect ourselves that we know is also necessary at that moment? And so I think that we're called in the state to do both things at the same time, which is to protect ourselves at the same time we're enjoying the new openings of all parts of our life that we are experiencing. And we know that we still are on the razor's edge of this pandemic, as Lacey noted. Case counts and hospitalization rates in some parts of our beautiful state have actually gone up. In Whitman County, the cases are averaging 493 per 100,000 residents. This is off the charts. And it's a demonstration what can happen to us if we start, partying like there's no tomorrow while not wearing masks, doing simple things. I was talking to somebody the other day who was noted that we're enjoying the rebirth of youth sports, which is really fantastic for our kids. But then driving home with, 6 people in an SUV, nobody wearing masks, and not everybody's inoculated, this is just too dangerous right now. So finding a way to open up while still masking up is really, really important, and I hope people will do it. We are so close, as Lacey said. We don't want to drop the baton right before the finish line here. And we need more counties to get like Snohomish, where they've got their numbers down to 40 per 100,000 instead of 400. We know we can do this if we will continue on this self-preservation track. And we know here's the other beautiful thing. We got the vaccine, which is a medical miracle, but we also have masks, which are handy, common sense, cheap, and we know that they work. So this is a balancing act, and if we keep our balance, we're going to get through this. I'm extremely impressed with the efficacy of these vaccines. I think people are overcoming some of their original doubts about it because they're seeing their friends and neighbors get the vaccine and they remain very healthy. And so that's improving over time, I think. But we got to make sure we keep these numbers down while this vaccine's getting here big time in the state of Washington. I'd like to address, if I can, some of the trauma we've all suffered in the last few weeks. We've seen increasing acts of harassment and intimidation against our Asian Pacific Islander neighbors. We've seen violence against them and mass shootings. We've seen mass shootings recently in Colorado. We're seeing intimidation, harassment, and gun violence that is extremely traumatic to all of us. And we all ought to feel that pain. And I wish I could tell you I have all the answers about this. I don't think anybody does. But I do know that doing nothing is not a response to intimidation, violence, and mass shootings. And so we need to continue to look for things that we can do, and we know there are things we can do. The Congress can follow us in some of our gun safety legislation, including gun show loopholes and the like. We can prohibit the use of weapons of war, of a bill I have supported for some time now in the state legislature. The legislature is working on a bill that would prevent people from being intimidated in public spaces by firearms, which the legislature is working on. We need to take action that is common sense, The moment calls for it. The people want it, and we should not allow politics to stand in the way. And I'm continuing to encourage our legislature in that direction. With that, happy to stand for your questions.
Hi, I have a question for the governor and then one for Lacey. Governor, I'm sure you saw that California announced today that they'll be expanding vaccine eligibility to everyone 16 and older starting April 15th due to a jump in their weekly supply. Has our weekly allocation recently changed enough that we might see a similar time frame here? I know you've said May 1st the latest, but I'm just curious if recent numbers have changed your thinking on that. And then for Lacey, just because you specifically mentioned WA notifying your comments, I'm wondering if you can give us any metrics on the effectiveness of that program to date. Last time I inquired about it, it sounded like the privacy settings around it are so tight that there wasn't a way to track how many codes were entered from positive cases or how many notification texts were sent out. So I'm just wondering whether people are using it as intended and whether it's actually useful in reducing transmission.
Do you want to answer that, Lacey, start?
Sure, I can start. So it's a great question, Rachel, and there are, as for anyone new to this, there are very strict privacy guardrails in the WA Notify or exposure notification system. The system does not know who you are or where you've been, and it works by exchanging keys between phones to identify close contacts, potential close contacts, and then when a user tests positive and enters a code or clicks the link to activate WA Notify, their close contacts, people whose their phone talked to, will be notified. And the power of this is it supplements our contact tracing, which allows more people to be notified more quickly that they were potentially exposed to COVID-19 and take action to protect themselves. So to your question about do we know if it's working, we are looking at some alternate ways to evaluate this, and in the process of mapping that out with UW. What I can tell you is we do have information from our testing sites. When people come to those sites, they often share why they're there, and we do have some numbers or examples of people showing up to the testing sites because they received a WA Notify exposure notification.
As far as opening up the eligibility, we're not currently thinking about accelerating that earlier than May 1st, and I'll share why. We want to make sure that the people who are most at risk in the vaccine have the prioritization. So we still have people with comorbidities that are at a higher risk of death, much higher risk of death than, say, younger, healthy people. And so our next prioritization opens up access to those with sickness and infirmities that would make them susceptible to fatalities. It also opens up access to the hardworking people who are on the front lines, who have to do their work exposed to thousands of people or hundreds on a daily basis. So there's a reason still to have when you have a limited vaccine, as we do, there's still a reason to have prioritization amongst all our great citizens, all of whom we love, obviously. And until we get through some of those people who are more susceptible to death, we think it makes sense to continue to have them in the priority queue. So we would not be able to get through them, I don't believe, at least at current rates, certainly by April 15th. So at the moment, we're thinking about continuing to basically say we think it's more important for a 63-year-old with, a double lung transplant and high blood pressure to get the vaccine as opposed to a 22-year-old, healthy person. And that's a priority decision. It's difficult to make priorities, but we think it makes sense because our ultimate goal is to prevent Washingtonians from dying. And I want to reiterate, we have made great progress in that. We've saved tens of thousands of people in our state, or at least thousands in our state compared to other states. And it's because we have focused on things that will keep people alive. And some of those decisions are difficult. Look, it'd be great to tell everybody in Washington they're eligible today. That would cause a lot more people to be eligible, but a lot more people would be frustrated, of course, because just by making them eligible doesn't produce one more dose that you can actually get in people's arms. So we're going to stick to this issue of trying to save lives at the moment. Now, that could change if the dosage supply increases, or if we accelerate through these priority arrays faster. And we don't know this for sure, but we might be going through these faster than we thought. So we look at this on a daily basis, but at the moment, we're not making a change at the moment. Oh, and let me mention one other thing too. Our strategy on this, I think, has also, there's some strong suggestion that our approach has also avoided problems. So there was some research that came out day before yesterday which showed that the states that took this wide open eligibility, so basically they said, everybody come on down. So you had massive frustration where people couldn't get appointments because there wasn't enough doses. Those states are the ones with the most troubled vaccine programs. They've had the lowest rate of vaccination, both as a percentage of doses delivered and those administered. And they think, we're not sure about this, it's because it caused so much frustration of people that people kind of gave up. And the ones that have been more successful have been the other side of the coin. So I think there's some reason to think our strategy has been the right one to date. We'll send you that article if you hadn't had a chance to see it, Rachel.
We've asked for state data on teacher vaccines and been told it wasn't available. What's your understanding of how many teachers in Washington have gotten a first dose and how many are fully vaccinated? And given that schools, at least some will be bargaining on returning still, how much difference do you think that today's announcement will do in the coming days and weeks?
Well, I believe it's going to give people, well, I know it's going to give people the ability to move forward and get more normal school operations in place. We believe there's very broad appetite for that. We think the combination of the new guidance from the CDC should give us more confidence in the ability to do this safely. And certainly the experience of our schools, which has been incredibly effective in reducing the risk of this, should give us confidence. So we feel good that this is going to get more students back into classrooms in the days to come. I feel good about that. Your question about the number of teachers vaccinated, I don't have a number or percentage. I've been advised we believe it's a majority of educators have had a first dose. But Lacey, can you go any further than that? I really don't have any further data.
We don't have data on what percent have been vaccinated. What I can share is that we believe the majority of them have had access, and certainly if there are educators, school staff, or child care workers out there that are wanting a vaccine and have not yet received one, please go to the vaccine locator and book an appointment. I also want to remind everyone that those groups, so school staff and child care workers, have priority access at the federal pharmacy participants, which are Rite Aid, Walmart, Health Mart, Costco, and I'm losing the last one, but I'll try to get it for follow-up to this question. We have heard that many counties are close to completing vaccination of their educators, and this is a priority for us as well. So please avail yourself to that opportunity if you haven't yet.
I do want to reiterate too that we have seen conclusive evidence that we are safe to go back to school even prior to the vaccination of our educators. The CDC has reached that conclusion. Over 200 school districts in our state have reached that conclusion and have been actually open for months with very minimal infections even before we had these vaccines available. So we think this is an added layer of confidence for people. It was not necessary for reopening, but it certainly is an added layer of confidence. And we think it's time to get back to school. The kids deserve it. They're suffering a mental health crisis in our state, and it's time to get them back in school.
This question is for the governor, and today Senate Democrats rolled out their operating budget proposal, and the plan includes tapping the rainy day fund, which your proposal also included originally, but some time has passed, and I'm wondering if that's something you would still support at this point, given the recent revenue forecast and influx of federal money.
Well, I haven't had a chance to look at the Senate Democrats. I haven't changed any particular position right now, so I'll reserve judgment, but I don't think there's a reason to believe that there's not still needs for financing in our schools and everywhere else. So I haven't proposed any changes from what I have originally proposed. I always suggest to legislators, all they have to do is pass the governor's budget and all will be well. So I'll leave it at that.
Next, we'll go to Jerry Cornfield with the Everett Hill. Go ahead, Jerry.
Governor, you mentioned a moment ago about the eligibility and for the healthy 23-year-old to sort of wait their turn, but there seems to be a trend of what we're calling vaccine chasers, where younger, healthier individuals are literally chasing that vaccine dose. I wondered if you had some thoughts on what you're hearing and what you're thinking or feeling about that development.
It's not surprising, and it's what's happening to some degree. And you know, look, we're trying to get as many people vaccinated with a prioritization that will save the most lives, and the plans we have will do that. I obviously encourage people to follow the rules. Cheating is never good. It's certainly not good in this circumstance. However, there are some circumstances where at the end of the day, if some provider has 10 doses left over, that we want to get it in, arms. And so that is wise. We don't want any of this to go to waste. And there are circumstances where that's appropriate because we don't want to waste any vaccines. So I would not consider that cheating. We got to get the doses into arms. By the way, if I may too, the rate of wastage, and this was a great concern when we started this endeavor, of having the match between first and second doses. We have storage requirements that are quite demanding. We were very concerned that we were going to have significant wastage, and it just has not happened at any significant degree. We're very pleased by that, and that's a testament to the efficiency of the providers and their flexibility and the good faith of everybody. So this is really good news.
Hi, Governor. I have two questions. The first is kind of a follow-up to Joe's. Is the state looking into tracking occupation data as far as vaccine goes, which might give a better sense of which sectors might be particularly hesitant or unable to get vaccines? And then secondly, for Lacey, I'm wondering if you can talk more about how the change to the 3 feet social distancing in schools might affect some of the transmission modeling that the state and IDM has already kind of done regarding school reopening?
Well, let me I'll tackle that and then I'll ask Lacey to add. As far as the occupancy, I don't believe we have seen a need for that at the moment. So at the moment, I don't believe we have tracked individual occupancy at the moment. On the issue about the modeling, we have had modeling done by the Institute for Disease Modeling, and they have shown minimal, if any, difference involving in-school transmission. And again, it tracks with the real-world experience that it just is not predictive of increase in rates of transmission, and that's been comforting. Do you have anything to add, Lacey?
I don't have much to add. I do want to remind people that we're looking at multiple sources of information when we're making these decisions, as is CDC. So, modeling tells us what might happen. We look at our own data in terms of where outbreaks are happening or transmission is happening and what might prevent that. And then there's literature that comes out, like these studies that have been emerging over the past few months that actually tell us what did happen and what made a difference. And I think the important message today I want to share is that we have studies from multiple states and multiple schools in those states that have used distances shorter than 6 feet, some of them as short as 3 feet, and that is what informed this guidance and this change at the federal level and within Washington State, that when we wear our mitigation measures, and wear our masks, that was really a really important finding of all of these studies. Wearing masks makes a difference and allows you to reduce your distance and get more children back into classrooms.
Up next, we'll go to Hannah Scott with Cairo Radio. Go ahead, Hannah.
Hi, Governor. A quick question, and you've sort of touched on this, both you and Lacey, already, but I'd like to have you reiterate. We've heard from a lot of parents who came across some leaked information that seemed to suggest there was a lot of pressure from the state teachers union to switch to this 3-foot distance rule, and they had concerns about that. Can you address that specifically? And then also curious if you would support an effort to revive bills that would ban high-capacity magazines and assault weapons in the state that already died this session.
Yes, I would support that. I think the evidence suggests this is necessary, and I've long supported these positions. So yes, I would. Look, we are dedicated to making decisions that will be good for our children. And I am so convinced that having more children back into school, to have those magic relationships with their tremendous educators, that is absolutely necessary to their well-being right now, for their mental health and obviously for their academic and social development. And these are decisions that I made in consultation with their Department of Health. Some time ago, we ordered the schools to make a hybrid option available, and now I am ordering, based on our decision-making, that we go to this 3-foot standard. And these are decisions we made for the benefit of our children. And I'm very confident that they are the right ones. I'll tell you what I think about when I make these decisions is the student, a friend of mine's twins went back to school the other day, and one of them dyed her hair pink. She was so excited. It's my grandkids who've come back and said, I was so excited, it made my teacher's heart happy. The eruption of joy and productivity of our students in combination with their educators has been huge, getting them back into school, and we want to increase those opportunities. So as far as pressure, some of the things that the educators union wanted, they didn't get. They wanted a delay of this. They didn't get that. I decided that was not necessary, and it was not necessary because I'm confident now that these innovative educators can put their minds to solutions and get these schools back open. I've seen it. I'm confident that's going to happen. So if there was pressure, it didn't work. We've made an order that's the best thing for our children, and I will remain observant and committed to that mission statement.
Next, we'll go to Keith Eldridge with Come Up. Go ahead, Keith.
Is there the potential that distance learning is here to stay, either for families that aren't feeling comfortable with going back just yet, even in the fall, and for other students who are actually thriving in distance learning? Could distance learning just be something that's here to stay because they've perfected it now?
Well, I think that we have had students that have done well in remote learning, and this, our order will allow school districts to continue that as an option for families. And I suspect it probably will increase as a percentage. I don't know for how long or what percentage, but I suspect it's like anything else. Some people have tried it, and for some people it's been a benefit. So no, I would not be shocked if an increasing number of students maintain long-term remote learning. And but there's just hundreds of thousands of other students that really need to be in a classroom with their teacher, and we know that that is a incredible relationship that can happen much more effectively physically. And we know thousands of educators want to get back in the classroom as well. It's not uniform throughout their ranks, but they want to as well, and that's why I'm confident we're going to get more kids back into the classroom.
We've got time for one more question, so we'll go to Ted Lamb with King 5. Go ahead, Ted.
Hi, Governor. Thanks for your time. Is there anything that could derail that May 1st eligibility expansion for all adults, such as, more metrics about earlier phases and their vaccination rates? And what can you tell us about what the supply will look like when all of the adults in Washington can now go out and get a vaccine?
Well, of course, you know, it's possible if there was a big disruption in the supply chain, that could derail that. It's possible if we, you know, had a huge spike where people with morbidities were dying and we had to get more vaccine to them first before we do other people. Those things are possible, but at the moment, the president has directed this. So this has been a presidential directive, and, you know, there'd have to be some significant change, I think, to warrant for the president to change his mind in this regard. Your second question was, what was your second question?
Just seeking some clarity on what you think the vaccine supply will look like when that day comes, May 1st.
Lacey, do you have numbers specifically? There are significant increases, but I don't have the numbers at the top of my head. Do you, Lacey?
We have pretty clear visibility for the next few weeks. We have about 408,730 doses that we expect next week. We have the 2 weeks after, so the week of April 4th and April 11th, a little bit less. 343,700 the week of April 4th, 368,270 the week of April 11th. Beyond that, we are expecting increased supply as we move farther into April. We don't have specific numbers from the administration yet, but based on, you know, what we are expecting and that May 1 deadline that we have to make all adults 16 and older eligible, we think we will be getting significantly more vaccine starting the second half of April.
So that's the information we have from the White House task force. We have weekly governor's briefings. Basically, they've told us that at that period, there will be very significant increases in the production. And I think there's pretty good confidence of that, having talked to the CEO of Pfizer and looking at the supply chain. And the reason that's possible is because, in part, because the president has used the Defense Production Act to free up supply chain to get some critical materials to the manufacturers so they can increase production. We're very appreciative of his leadership on this. It's one of the things his predecessor refused to do. So we're really happy with what the president has done here.
Other words, Governor?
No, except that I think there's reason both for joy and diligence today. I'm very excited about now having a chance for more kids to get back into the classroom. I'm very excited about people enjoying their friends outside, but I sure hope people will continue to be careful. These masks can save lives as well as our vaccines. Let's keep using both. Thanks a lot.